Jacqueline, thank you for your introduction to your patient. The patient, a 50-year-old male, is presenting to the clinic for an annual health assessment. The patient appears malnourished, with jaundice noted to his bilateral sclera. The patient reports lethargy, mouth issues of dryness and a burning sensation, difficulty with his bowel motions, and a history of hepatitis diagnosed due to alcoholism. The patient reports he is an alcoholic who was sober until 6 months ago. As the nurse practitioner caring for this patient, labs would definitely be ordered. The resulting lab work results are a red blood count of 3.7, hemoglobin of 10, hematocrit of 40%, an MCV or a mean corpuscle volume of 78, and a mean corpuscle hemoglobin of 22, as well as folate of 3. So now we will begin our interview with the patient. Good afternoon, Mr. Patient. I have been reviewing your medical history and your reported symptoms. These reasons are why we obtained the blood work that we discussed earlier. I would like to discuss these findings with you. The levels that are indicated with your results are indicating a diagnosis of microcytic anemia. Have you ever heard of this before? I would like to discuss this diagnosis with you, if that's all right with you. Microcytic anemia is defined as a term used to describe smaller than normal red blood cells, as well as fewer red cells than normal. This type of anemia happens when conditions in your body prevent you from producing enough blood components called hemoglobin. Hemoglobin's role is to transport oxygen to your body's tissues. It is also what makes your blood red. There are several types of microcytic anemias, such as hypochromic microcytic anemia, including the most commonly recognized type of iron deficiency anemia, and sideroblastic anemia, which is something you are born with. There are anemias caused by chronic diseases and inflammation. These are known as normochronic microcytic anemias. These anemias that are called hyperchromic microcytic anemias, which are also anemias that you are born with, the genes that cause this type. Other causes of microcytic anemias include alcohol and drug usage. As you have stated, you have relapsed in your sobriety with alcohol, along with your lab results, therefore leading to this diagnosis. Treatment for microcytic anemia is going to focus on treating the underlying issues that are causing this. As stated by several experts, treatment needs to be iron supplements that you will take by mouth, as well as vitamin C tablets that you will take by mouth. As I believe this to be a result of your alcoholism, we must look at several different treatment modalities. It is possible that the anemia is a result of altered liver function, or perhaps gastrointestinal bleeding as a result of the alcohol. Due to your symptoms, I do believe that you have a problem with your liver, and we will need to do more testing to determine the extent of your liver issues. Have you noticed any vomiting that looks like coffee grounds or dark tarry stools? You mentioned difficulty with formed stools. What do your stools look like? To answer your questions regarding how your liver could be the cause of your anemia, I would like to explain how this works. Anemia in patients with liver disease from alcohol is the direct result of the toxic effects of alcohol on bone marrow. This means that alcohol causes the bone marrow to not produce red blood cells like they should. I believe that we will need to complete further testing to identify the exact cause and treat underlying conditions, specifically your liver functions, as part of a multi-step treatment plan. I hope that this gives you some information and some direction as we start this process. Thank you very much. And I apologize, I seem a little distracted, but my daughter is actually in the emergency department being treated for an ATV accident. Thank you and have a nice night.